the sign language interpretation tonight is David Agondoa. Tonight, medical practitioners are raising concern over the country's ability to manage a potential M-Pox outbreak. The Kenya Medical Practitioners, Pharmacists and Dentists Union says Kenya's health sector is underfunded and that there has been no implementation of the proposals made in 2020 to manage any potential outbreak. NTV's Helen Aura starts us off with the story.
The confirmation of the second M-Pox case in Kenya has heightened concerns about the country's preparedness to handle the virus, which is spreading rapidly across the African region. The two positive cases linked to truck drivers, with the recent one detected at the Malaba one-stop border. The Ministry of Health insists that it is actively managing the situation. Residents of Malaba in Busia County are growing anxious as they recall the early days of the COVID-19 pandemic, when high case numbers were first reported at the border points.
Watu wanaanza kuvuka kwa border, pengine mtu anatoka Kongo, anatoka Uganda, anatoka Zaire, anapita hapa hivi na pengine ana hizo virusi. Na tunawabeba kwa zaidi, hao ndio wateja wetu.
But the Kenya Medical Practitioners, Pharmacists and Dentists Union, KMPDU, warns that the country is not adequately prepared for potential new outbreak.
We must have functional healthcare system. We must have a public functional healthcare system into the counties and the facilities. The budget in healthcare is always 3%. So there is no way we can access healthcare without investing in it. We are ready, and we need to do more.
As the situation develops, the balance between governmental assurances and professional skepticism will be crucial in navigating the response to M-Pox.
The backbone of fighting pandemics is a functional public health care. But it seems that was just a lesson that was learned with no much implementation to it. Because 5 years down the line now that there's a bit of a scare of M-Pox, we have not seen much of action or much of implementations of the things that were proposed well down during the COVID-19.
The Ministry of Tourism, on the other hand, has issued a warning to Kenyans against the consumption of bushmeat, since M-Pox can also be transmitted through wildlife. The first 10,000 M-Pox vaccines made by Bavarian Nordic and donated by the United States are set to arrive next week in the African continent. Kenya is expected to get its first batch of 50,000 vaccines in December. The slow arrival of the vaccines to African countries continues to stress the healthcare inequities similarly experienced during the COVID-19 pandemic.